Hello, and welcome to this webinar on how simulation has been used to test the long-term and operational impact of policy idea. I'm Tom Stephenson. I'm the Head of Customer Success at Simulate Corporation. I've been a consultant for 6 years where I've used simulation to look at numerous problems across healthcare, manufacturing, back office, and policy. And it's going to be those policy simulations that I'm going to be talking about more today. We're going to go through a brief introduction to simulation and especially discrete event simulation as well, which is where I specialize. I'm then going to give you an overview of why simulation can be a useful technique when you're looking at policy and decision making. And then I'm going to look at some case studies from different sectors and different countries. So what is simulation? We're imitating a system as it passes through time, looking at how the flow works, really building up the flow as it is in a virtual environment. Now, the real benefit of having the flow in that virtual environment is that you can investigate the impact of change. This is what I call my what if scenarios. So we can test out a lot of different scenarios and see how they're going to look in the future, especially when we bring into account like changing demographic of our population and that kind of thing. So doing this reduces risk and it helps us make decisions based on evidence. I'll show you an example just to hopefully make that clearer. So this is a healthcare example. We're planning NHS services and we've got 4 services as just a small sample of a simulation. But if I run this through, you're going to see people are using these services and they're using it from 6 different groups. And as they use these services, we are going to get some results. These results are going to be about how many interactions with the service there have been. We're also collecting some cost results associated with that. And we can run this through for as far in the future as we need to see what the impact of change is. Now, what I want to do when I'm sure that this simulation matches my current scenario is investigate change. And in this change, I'm going to build a community hub. So this community hub is going to be a new service in a new area. And the idea is that some of the patients who would have used these alternative services will now receive their treatment here in this community hub, which has been set up as a means of maybe taking people who are quite a big strain on the emergency departments and giving them better care that's more appropriate for them. It might be maybe an elderly population or those with certain conditions. So what you'll see is that there are quite a lot of people using this community care hub. There's still people using the services that are currently here, but hopefully that should be reduced. And I'm going to run this through quickly again to see the result. So we can see we've had a lot of interactions in the community care hub, but these are relatively cheap and it's reduced amount of interactions with secondary care and emergency care out of hospital, which of course is going to have knock-on impacts, which again you can test in the emergency department in the simulation, such as how your waits for beds might be reduced. So why is it a useful technique, particularly in policy? I guess first of all, there's so much data available to users now. We're collecting data in large databases. This is just an example of the amount of data that gets collected every minute by social media applications. It's quite similar in a lot of policy and decision making. So we've got all of this data, which is great, but sometimes it's difficult to interpret, sometimes it's difficult to understand, and a lot of the time it will just be sat in a database unused. So what simulation can do is really illuminate some of that data and bring meaning to it, which is going to be really useful to help communicate ideas for change. The real advantage of using a simulation to do this is the visualization element of it. It helps people to understand the complexities and fit the pieces of the puzzles together. It helps a lot with communication as well, because you can see the flow. You can see where bottlenecks are occurring. You can discuss those bottlenecks and really strategize about how you might want to change the system. Often people are going to be very engaged when they see a simulation as well, and all of this should lead to better solutions. The other good thing about using simulation is that you can apply real-life variability. So that can be long-term variability or short-term. So it might be that if we've got a system that changes every hour, we can include that variability in there. Operationally, some of the ideas for this might be different hours of the week where we might have different shifts or different levels of demand. In the long term, we can include things like seasonality. What's particularly important is population growth and population change. When we're setting any policy, we want it to serve the goods of the needs of individuals within our particular population. So if that changes or grows, then the method which best serves the population might need to be different. We can look at the changing external environment as well, so things like political change, economic change. So some case studies from different sections. I guess healthcare, social care, justice are the main ones that we're going to go through, but we've seen simulation used in defence and environment and recycling. When looking at new technologies or employment, and we've seen it start to be used in smart cities. So starting off with healthcare, some of the challenges that we see faced in healthcare a lot might be things like budget cuts, which means healthcare needs to adapt. We need to keep patients away from that costly emergency care, which might mean more care in the community or working with social care more closely. We have got population change. People are living longer. They might be living longer with increased health concerns, things like long-term conditions, and also in the UK, in the US, in a lot of different countries, we're seeing increased obesity, which is causing more of a strain. And patient safety is very much a key concern. We need to make sure that we are treating patients in a consistent way, and in the best way to treat their needs. So here's an example like the one that I showed at the start. This was in Northwest Surrey, working with the Academic Health Science Network. They wanted to look at the impact of adding a locality hub which supported older people. I need to know how much demand there's going to be for the service, what is the capacity required to meet that demand in terms of staffing, and what is the impact on other services. So we started off by looking at how the population is likely to change. We can do this by looking at publicly available data, or we can use our local predictions. But we've projected forward 50 years, and we've seen that the 85 plus in this area is likely to grow quite a lot, whereas we expect more stability in the 75 to 84 category. We then mapped out all the pathways, and because we wanted to look at the knock-on impact on other services of this new service, we've mapped out quite a lot of different healthcare services. We looked at how the primary care hub is likely to work as well, so 3 visits over 3 days if we're an emergency care avoidance. If we're elective, we thought it would be a bit different and would have a first and then 2 follow-up every 3 months. And we looked at the staff requirement. We looked at which services are likely to take patients on, and then we could see, well, which services are those patients currently using, and how much activity can we take away from those services. And what we get by doing that is looking at the long-term high-level results first. So we could see what the baseline would be if we didn't have the service in terms of attendances. We can look at what the new result would be, and we can see how that compares to what was predicted locally. So we can see if there's a difference between what the simulation is producing and what is predicted locally, and act accordingly. Once we'd looked at the high level, how many people are likely to use the service, this is where we could look and see, well, how many staff do we need based on that number of visits? And assuming we can't have staff being 100% utilised, we could make an estimate of 15 staff being the good starting point. We did find actually for this one that after 2 to 3 years, that staffing requirement is likely to not be suitable anymore, and waits would get too long. We're doing a similar project on this on a national scale to help advise policy. So we work with NHS England to test the financial impact of person-centred care for people living with multiple long-term conditions, and that simulation is actually available online. Taking an example from outside of the UK, we looked at maternity treatment for those who are uninsured in Canada. So this was with Mount Sinai Hospital, who work with a large population, 1.17 million patients. Many might be uninsured, but we use simulation to build a case for decision makers to offer prenatal services to those who are uninsured. So, the reason for this is that it's common for uninsured women to enter the hospital through the emergency room towards the end of prenatal services, if they don't receive those services at the start. So being uninsured, they won't receive any services because it costs money. But the problem is, then they are likely to come into the emergency room later. They're likely to have greater health concerns, which actually is going to generate more of a cost and more of a burden to the healthcare system. So what we could do by building a simulation is show what mitigation could be against those people arriving in the emergency room if early interventions were provided. And the outcome of this was that actually enough evidence was gained to support the initiative. Some of the things in healthcare where you could use simulation for policy, and where we've worked with people, are looking at 4-hour waits for A&E, how that policy is going to affect certain hospitals, how you could look at an 18-week target for surgical treatment. Or, as we said at the start, because a lot of services need to take patient safety as a key concern, in the UK we have NICE guidelines which are going to advise hospitals or caregivers how to act in certain situations, and simulation has actually been used to inform some of these NICE guidelines. Now I'm going to take a look at social care. So some of the common challenges here are we have very much a changing environment. So we have increased digitization of healthcare records and that kind of thing, which means we really need to change the way in which we work. There's also a lot of increased geographic mobility. So in a lot of big cities, we've got a lot of inward migration, and we have an aging population as well. So one example that's used simulation was from one of our partners, NovaSim, and they used it to look at homeless services in New York. So in New York, there is a right to shelter law, which means anyone who needs a shelter must be given a bed. So what the Department of Homelessness Services did was had to look at how their population is made up, how their population might change in the future, and based on that, how many beds they need to ensure that they're going to meet the needs of the homeless community. And that's in an area that is highly variable, especially in terms of seasonality and needing shelter at certain times of the year. So you can build in all of that information into the simulation to give you an accurate representation of demand. And this is a good one where simulation can handle variation very easily. We've actually worked on some different simulations in this area, things like looking at child health records, and how the digitization of those is going to change the way social care needs to work and how we can streamline the processes and save money. So justice is a slightly different area, but it's another one that's quite complicated. You've got a large system that needs to work well together. You've got 999 calls, you've got the court, you've got prison, you've got parole, and there's so many different paths that can be taken within that system. Also, it can be difficult to understand how the long-term impact of decisions made now can kind of impact the future. So if we change parole laws or make the parole laws more lenient or less lenient, how is that going to actually impact the amount of prison cells we have? Those are the types of questions that are common for simulation. One of our clients who uses simulation very well is Applied Research Services. They look at prison populations based in Texas. And some of the examples of work they do is to look at the long-term impact of policy and budgetary decisions in the long term and drilling down into short term. Some questions that are commonly looked at might be release policies. What if we change, extend them, make them shorter? Rehabilitation as well. How will introducing those services affect things in the long term? Population change is a big one. If we've got increased poverty, increased deprivation in an area, how's that likely to impact our prison populations? And sentencing policies as well. If we have new guidance into sentencing policies, that's going to impact how frequently our prisons are going to be needed to be used in our courts. In short term, you can use it for things like jail booking, inmate pickup and delivery plans, or even prison classifications. So a really wide range of areas that simulation has been used effectively, and you can see more examples of the work Applied Research Services have done on our website. In the New Jersey government, we've actually had clients looking at the bed basis for population with mental health concerns as well. So we know these patients are highly likely to commit crimes if not placed properly, and we can see that from past data. We know the cost of these crimes to the state compared to the cost of funding extra care and adding extra beds is high. And also the added complication was that there's already a queue for these beds. There's already people needing to get into them. So we didn't actually just need to handle new demand, but also need to see if we can do something to handle the backlog as well. So simulation was used to really advise that and see exactly how many beds should be implemented. The final area that I want to look at is smart cities, and this is one that a discrete event simulation has probably been used for less right now, but I think it's an area that could be a useful thing to use discrete event simulation alongside in the future. So some of the common challenges are poor building placement that could lead to traffic jams, clusters of people trying to move in the same way and using all the traffic services, blocking roads, that kind of thing. Emergency vehicles need to be quick. They need to be able to navigate around traffic. They might need to even control traffic lights and things like that. This can be especially useful when we've actually got self-driving cars, which or I guess in the future may be inevitable. There's also a reduction in carbon footprint that can be useful for smart cities. So I've taken some studies and found some online useful studies of how simulation has been used for smart cities. The first one was about designing an intelligent intersection, which is really going to help with this vehicle management problem. So basically we looked at the traffic light rules for certain movements of vehicles, looking at things like how we change traffic lights based on the traffic that's all talking to each other. So this team actually, by building a simulation on a really small traffic simulator, that you could reduce vehicle delay by 85%, fuel consumption could be reduced by 50% in this area from not starting and stopping so much, and emissions actually reduced by 39 to 50%. So quite bold improvements can be made by making this change, and that can all be tested, and you can make a business case for it by building a simulation. And I mean, even if you don't agree fully with these percentages, it definitely creates a strong case for change, because we can be quite confident that even by adding in a confidence factor, we're still going to see a very positive change. Another idea was a novel smart parking simulation, and that actually used mixed integer linear programming simulation rather than discrete event simulation. But what it did was look in an area and reserve an optimal parking space based on the proximity to the area in which you're trying to go and the cost in which you have. So it factored in those two elements to give a more optimal car parking space, and then actually reserved that space for a short time before the person needed to park. So compared to just an uncontrolled parking, this gave a very significant cost and time reduction. And again, this was tested using a simulation. So thanks for listening. That was just a few case studies from a few different sections of where policy can be simulated. If you have any further questions, please don't hesitate to get in touch. You can email info@simulate.com, or you can add me on LinkedIn. Thank you.